Now, good evening and welcome to Coffee with a Bishop. I'm so glad you're joining us today for our COVID-19 community. And we want to let you know that there are things that are going on that God has some answers for. As we pray together, as we stand together in unity, no matter what walk of life we come through, we can stand together in unity. And as we do so, we know one thing for sure, that if we stand in unity, there's strength, and that strength brings forth power and brings forth love and grace. So I'm glad that you joined us today. We ask that you share this page with someone else and let them know, create a watch party, if you will. We have some great people on with us, and I'm glad they're here. I'm so glad to have Michele Baehr, Executive Director of American Red Cross, Pocono Mountain Chapter, Tameko Patterson, President of the Stroudsburg School Board and the Greater Pocono section of the National Council of Negro Women, and Michael Tukeva. If I said it wrong, please forgive me. President and CEO of the Pocono Mountain United Way. And we have Dr. Crumpler Daniels, Lehigh Valley Network Infectious Diseases. Good evening to everyone. As you can tell, it's been a very rough day for mostly everybody who works and has been fighting with everyone else to make sure that we can stand together in unity, answering questions, opening up information for people, and letting them know that things are going to be all right if we can just stand together. Dr. Crumpler, I would like to ask you, if you don't mind, could you introduce yourself, tell us what you do, and a little bit more about what's going on with the coronavirus.
Coronavirus. You know, Coronavirus is it's a RNA virus that became a big epidemic. It became a big outbreak in China recently, and as we know, we're hearing in the news, it has spread into Europe, and we're seeing the big surge in the United States right now. New York obviously has been very hard hit, and the East Stroudsburg area, having so many people that work in the New York area or live there and vacation here, we've also been hard hit. For our population density, we have a very high rate of positivity in our local community, and our hospitals are really feeling the burden right now. Last week and the week before, we had increased traffic, but this week it's really, it's a lot going on in the hospital. So as far as general knowledge, I think for people that are at home, I think the best advice would be try to stay home, try to self-isolate. If you think you have coronavirus or you've been exposed to it, if you're feeling symptoms, you may have it. There are varying degrees of symptoms that people can have, and the vast majority of people will have some mild symptoms and do very well. And at this point, there's a lot of development in our testing abilities and how we can get tested. But for most people, it's not worth the trouble to get tested. If you think you have the disease, then my advice to you would be to stay home, isolate yourself, use Tylenol for fever, take in lots of fluids, try to restrict yourself to one room. If you live with other people, try to use a separate bathroom. If you're in contact with your family members, you should ideally wear a mask. And the reason to go to the hospital would be if your cough is worsening or you have trouble breathing. That is the main point of hospitalization, is to be able to support people's breathing. The coronavirus, COVID-19, the disease is a little different than previous similar illnesses that we've had circulating in the population. It can affect the lung tissues more preferentially because of the way the virus attaches to certain cell receptors that we have a lot of in the lung. So there are some people that will have difficulty maintaining their oxygen levels when they get this illness. And if you think you are having difficulty breathing, then you should seek medical attention right away. If not, then I would advise staying at home. The most common symptoms we're seeing are cough. Cough is probably the most common complaint, a dry cough. About half of the people will develop fever. Some people don't develop fever, and a very small number, about like 10%, will have just GI symptoms. You may have some nausea, vomiting, or diarrhea. We've seen that as well. But the big thing is if you have trouble breathing, that would be the reason to go to the hospital.
Okay. Well, one of the things I want to say is thank you so very much for the time that you've given and the time that you have worked at the hospital working with the people. And if no one has got to say thank you to you, our faith community want to say thank you, and all of the ministers and bishops and pastors of the community, thank you for your service that you give in serving the people. But one of the things I want to ask, can you explain some of the methods of transmission and why the social distancing is so important?
Yeah. Okay. So there, a lot of the information we're using about COVID-19 is not based on really well-studied data. A lot of our medical recommendations today are based on studies with very large patient populations, and they're done with randomized controlled trials. The information that we get kind of evolves as we see more cases. But right now, we believe that coronavirus is most probably transmitted by droplet means. That means when someone coughs or sneezes, they release particles into the air that fall quickly to the ground. And there are studies that show that the virus can be transmitted or is present in the blood and is present in stool. And there are studies as well that suggest that certain bodily fluids can carry the virus, and it can stay present on inanimate objects for some time. And over 72 hours, the viral load and the transmissibility does decrease significantly, but with preliminary evidence, we do believe that you can transmit the virus from inanimate objects if someone were to leave some bodily fluid on surfaces. So that's really why it's so important to cover your mouth when you cough or sneeze. It's also really important to wash your hands frequently. And the social distancing, we advise if you're talking to someone, try to maintain 6 feet distance, because that's from our knowledge medically that 6 feet is adequate distance to prevent droplet transmission of diseases that are transmitted that way. I know a lot of these precautions that we're taking, it's a very different situation than we've seen before, but it's precautionary in a lot of ways so that we do not spread the disease. And infect the more vulnerable patients. And it's also so that as people get sick, this virus is known to be more transmissible in some ways than other viruses, like the influenza virus. And this is a new virus as well, so we don't have, most of us don't have any immunity to it. So it's very possible for many people to get sick all at the same time. And our healthcare system, it is very stressed right now with the volume of people that are coming into the hospital. And these measures are to prevent the existing medical structures from being even more stressed, like we see in Italy and China. We want to, most people will probably get sick at some point, but we want to be able to kind of spread it out so that not everybody needs medical care at the same time. And over time, as more and more people are exposed, we're going to develop immunity, and getting the virus may not be such a big deal. We might be able to fight it off more easily and spread it less easily and things like that.
Okay, so can you tell me, so what are some of the current numbers of the coronavirus cases in Monroe County versus the state of Pennsylvania?
Well, I know that there are 4,087 cases confirmed in Pennsylvania and 48 deaths in the state of Pennsylvania. Monroe County is a hot zone in terms of how much, we're not that densely populated, but our proportion of positive tests are high. I can't tell you exactly. The last number I heard about Monroe County was last week, and I'm sure it's changed a lot. It was, I heard 43 last week, and I'm sure it's nowhere near that now. Part of the issue with these numbers at this point is that we're basing it on limited testing. We don't have the capacity to test everyone that may feel slight symptoms or were exposed to someone that may have had the disease. So when we calculate a mortality rate, which is, the people infected, over, the number of deaths versus the total number of people with the disease, it's not going to be that accurate because we don't really know how many people are infected, because a lot of people are asymptomatic or mildly symptomatic and may not seek that out. And, at this point, I advise them not to seek it out because we don't have the means to test, and they're kind of exposing themselves and other people to the disease by going outside and going to a testing facility and such.
Well, I want to thank you for your time, and I know you said you had other things to do, and so we thank you for joining us. And again, we thank you from our hearts to you, Dr. Daniels, for the job that you've done. But as we move on here today, yes, ma'am. Dr. Daniels.
Thank you. Have a good night. Okay. Yes, thank you for having me. It was a pleasure.
Thank you, Doctor.
Now, when we see that our area is vast, we have some people that really serve, and they serve our community really well. And Michele Baehr does a very good job at the Red Cross. And so come on, share with our audience what we do at the Red Cross.
It's wonderful to be here with everyone this evening. Thank you so much for serving on the board of the American Red Cross. It's always wonderful when our missions cross over with other wonderful leaders within the community. And what I really wanted to talk to everyone about this evening is really about the number of blood drives that have been canceled across the United States. As of yesterday, we had nearly 12,000 blood drives that have been canceled canceled. And a lot of that has come from all of the schools shutting down and local businesses, obviously, being shut down state by state. And because of that and all of the concerns with COVID-19, we have over 325,000 less units of blood that have been collected. So we have some good news with all of that because the community that we work with is so amazing. And we want to say thanks to the many people that have given blood and scheduled blood with upcoming appointments. The American Red Cross actually has been able to meet our immediate patient needs just over this last week. During these uncertain times, we encourage individuals to keep your scheduled blood donation appointments and make new blood donation appointments for the weeks ahead to ensure a stable supply throughout this pandemic. This is not a short-term thing. You don't need to give blood next week. We are going to be trying to catch up from those 12,000 blood drives as well as the 325,000 units for many months to come. And there remains an ongoing need for platelet donations due to a very short 5-day shelf life. And in times of crisis, the Red Cross is very fortunate to witness what we call the best of humanity as people really roll up their sleeves to help those that are in need. We greatly appreciate the generosity of the public. There's no known end date to this pandemic right now and the fight against COVID-19, but the Red Cross needs the help of blood and platelet donors and blood drive hosts, most importantly, to maintain a sufficient blood supply for the weeks to come. It's very important to remember that blood is perishable and cannot be stockpiled. And there was a really cute thing going around a week or two ago that talked about running out of toilet paper and what a tragedy that would be. But imagine putting that type of tragedy against running out of blood supply to be able to help our nation. And the American Red Cross provides over 40% of the nation's blood supply. So each and every Red Cross blood drive and donation center has followed the highest standards of safety and infection control, and to ensure the health of not only our employees, but our volunteers and our staff. We've put many new precautions in place with COVID-19 being out there. We check the temperatures of every staff member and every donor before they enter the drive in an isolated area to make sure that before they even come into the blood drive, they are healthy. We will allow a temperature up to 99.5, but if you're any more than 99.5, you will be asked to leave the premises and you will not be able to enter our blood drive. We're providing hand sanitizer to use before and after the drive, as well as through the donation process. We are certainly following the social distancing rules that the doctor just spoke about between donors, including our entry, donation, and refreshment areas. We are constantly disinfecting surfaces, equipment, and any areas that are touched by our donors or staff. We are wearing gloves and changing those gloves frequently, using sterile collection sets and aseptic scrub for every single donation. And just this week, starting yesterday, our staff has started wearing basic face masks to protect themselves as well as the donors. And, there's been a lot about social distancing that's been talked about and staying home. And we've had a lot of questions to the American Red Cross about these shelter in place rules and the stay at home orders that have incurred. And at the same time, we're encouraging people to go out and give blood. So blood donation is considered an essential service and critical infrastructure function as determined by the United States Government of Homeland Security and many other federal and state and local authorities. Healthy individuals can still donate in areas that have been issued the shelter-in-place declarations. The Red Cross is working closely with national and local officials and recommends people leave their home only for necessities, be that healthcare, groceries, or blood donations. In fact, the U.S. Surgeon General has said you can still go out and give blood. We're worried about potential blood shortages in the future, and social distancing does not have to mean social disengagement. The U.S. Department of Health and Human Services and the CDC and the Prevention with the Food and Drug Administration has also issued statements encouraging blood donations for those that are well. And during a crisis, as I said, we see the best of humanity when people step up and help their neighbors. Amid this COVID-19 emergency, we are asking individuals to take this responsibility very seriously, practice social distancing, and donate blood. These two activities, which are not mutually exclusive, will go a long way in keeping the community members healthy by slowing the spread of this virus and by ensuring that patients across the country receive this life-saving blood. It's also very important to note that blood drives have the highest standard of safety and infection control. We're spacing beds also to follow the social distancing practices between blood donors and are looking to stagger blood donor appointments further apart to reduce the number of people at a drive at one time. I personally gave last Friday at a blood drive that my church sponsored, and I'm really happy to say that it was an amazing experience. It feels so wonderful to be able to give back to the community during this time of crisis. And in 56 days, I'll be able to donate again. And so should you if you are a healthy blood donor. So please look on redcrossblood.org for local blood drives near you, and do not hesitate to book an appointment further out. Right now, we have a lot of people that are coming into our drives, and we love that. We're so appreciative of everything everyone is doing. Don't get discouraged, though, if you can't get an appointment for a month or so. We're going to be trying to make up for that deficit for quite a long time. We've also been asked about the other areas of what the Red Cross is doing during this COVID-19 crisis. We continue to serve all of our mission activities, and our mission is to prevent and alleviate human suffering in the face of emergencies. And we do this by the power of our volunteers and the generosity of our donors. So yes, we are still responding to all of our local crises, which generally tend to be home fires in our local area. We have put a lot of things in place to make sure that not only are our volunteers protected, but also our staff, with being able to contact people through all of the technology that we have. We've been able to supply them with immediate financial needs that will help them with food, clothing, shelter, medications, eyewear. And we've been able to do that all through the power of technology, iPhones, iPads, and social distancing taking place. And as this crisis continues, we will certainly continue to look at where we need to have emergency shelters put in place. And yes, we will open disaster shelters at the request of our emergency management and in coordination with our local public health authorities. And our goal will be to provide anyone that is in need after a disaster with a safe place to stay where they feel comfortable and welcomed. And to keep these people safe, we will work with our local authorities and put additional precautions in place, including putting health screenings in place to process everyone coming into our shelters, creating an isolation area if necessary, if someone is testing positive for COVID-19, providing masks, tissues, and plastic bags throughout the shelters, following all social distancing rules as much as possible by staggering meal times and adding extra spacing between our cots, tables, and chairs, providing additional hand washing stations in addition to our normal restroom facilities that are provided by our shelters, and increasing our wellness checks to identify potential illness, including self-monitoring and checking temperatures of both the staff and the residents and our volunteers, and of course, enhancing both cleaning and disinfecting processes throughout the shelters. Currently, I'm happy to say we do not have any of these isolation shelters open, but we have spent 2 weeks planning for what the next steps for the Red Cross will be if we have to open these shelters or if we have to start canvassing neighborhoods to provide much needed food, water, and disaster spiritual care and mental health care during this time of crisis in our nation.
And you said a lot. Yes, yes, yes. And that's the good thing. And so everyone should know that the Red Cross is out there. Now, I'd like to ask you a question. How can the community, we the community, help with donations for the Red Cross?
Well, what you can do is really look up the blood drives under redcrossblood.org. And even if you schedule an appointment a month or two out, that's fine. We are always accepting financial donations, and you can do that on redcross.org. You can do all of that virtually. And that money is really going to ensure that we are able to not only increase the staffing that we need at these blood drives and also all of the staff resources, but they will also ensure that due to this coronavirus outbreak, we will continue to provide our critical disaster relief services, including equipping and training our volunteers and staff to safely provide food, shelter, comfort, and relief supplies to those affected by disasters of all types. And donations are also being used to invest in that technology I was speaking about and training to make sure that we can provide counseling, financial assistance, and other relief supplies remotely. So giving your time, giving your talent, giving your energy. If you'd like to be a Red Cross volunteer, you can go on redcross.org, ways to help volunteer. We're always looking for people that can donate their time, their talents, their money, their blood, and there's something that everyone can do to help support the American Red Cross during this time of crisis and during any time of crisis. And Bishop, I'd also like to say, not as the Red Cross director, but as a Christian woman, I was reading my devotions this morning and I came across a wonderful passage that I wanted to share with everyone in your faith group tonight from 1 Corinthians chapter 15, verse 58. And it says, "Therefore, my dear brothers and sisters, stand firm. Let nothing move you. Always give yourselves fully to the work of the Lord, because you know that your labor in the Lord is not in vain." And thank you for everyone that is out there being the hands and feet of our wonderful Savior, Jesus Christ.
I'm so grateful for that. And I know the community is grateful. And I'm so grateful to have Michael on here today from the United Way. And what I want to say is that makes the difference that everyone that we invited on, it's like reaching across the aisles. And we want to just make sure we serve our community. And that's what's important. And Michael does a great job at the United Way. And will you come on and elaborate on the things that you do, sir?
Certainly. And I'm on the Facebook page, so if there's something that anyone from the audience would like us to talk about more, you can just drop that into the comments and I'll try to respond to it on the fly here. We've been coordinating a lot of the humanitarian response by posting a crisis response website, which I dropped into the comments earlier in the call. Essentially, it is a resource that is pretty comprehensive in its nature. It has information on food access points, whether that is through the public schools, the food pantries, community meal sites. We want to capture that all in one place. There's also information about housing assistance and utilities. At this point, people probably are already aware that there has been a hold on all evictions and that there is a moratorium in place for utilities. That should relieve some stress from people's hearts and minds at this point. The hold on evictions is through the 27th of April. And the utilities is a standing order while there's the disaster in place, the disaster declaration in place. You'll also find that there's educational resources. We point to the healthcare systems and the protocols that our community is asked to follow if they are having symptoms. There's information on SNAP benefits, behavioral health supports, as well as small business administration. Just recognizing again that there are many challenges and we want to capture everything in one site. And then finally, childcare. Several childcares have been able to receive waivers to remain open, and that information is listed for those that are essential workers. Some of our additional response has been to, as I said, coordinate these calls on Mondays and Thursdays at 11 a.m. So for those that are interested in joining that to learn about what community efforts are in place, what needs are out there, what challenges and what the response is, you can send me an email. I just dropped my email into the chat box, and we'll get you invited to those calls. We also started a crisis response fund. We've raised about $100,000 in the first week, and that money is going to frontline activity for the response. We've dispersed about $15,000 to date, with the intent of another $10,000 by this Thursday. So for those that are interested in supporting that, or for nonprofits that are interested in applying for funds, that information, that's my son. You can go onto our website, get information about the fund, apply for it if you're a nonprofit, and hopefully we can support your efforts as well. Also, as we got creative, we decided to start a GoFundMe account that would allow us to support local families in need with gift certificates from local restaurants. We recognize that it will be some time, and we want to support local businesses in that way. So I'll pause just to see if there are any questions.
But I want to ask you one question. How can people financially support the mission of the Pocono United Way?
There's really two ways, and that's where the crisis response fund, as I said, we've raised about $100,000 already, but we know that money will go quickly. So those that want to donate to that can certainly do so. I just dropped in the PayPal information there. People can also just send it to our physical address if you prefer to donate with a check. And then the GoFundMe is another way to support local families and local restaurants at the same time. And for both of those, the Crisis Response Fund and the GoFundMe, we've made the decision not to assess any administration or overhead fees to this. So 100% of your contribution is going to support the local community.
Well, I want to say that I always see you out there. You're always in the thick of everything. And I don't get to say much to you all the time, but I want to say to you today, thank you for what you do and the work that you put out there. Between what I see that Michele does and I've seen that you've done, it has really blessed our community. And a lot of times we don't get to say thank you as we ought to, but from our faith-based community, we say thank you to you today. And it's good to see you hug your...
Praise God.
I said, I'm sorry.
I said, praise God, yeah. And, obviously everyone's working from home, so it's the new norm to have your children show up on Zoom calls.
Yes, and what an encouragement it is for someone that's at home today. They saw you hug your son, they'll hug their child. So I'm going on to Tameko Patterson, and I'm excited about her. She's been the president of the school board of Stroudsburg, Pennsylvania. And what plans does the school board have in place and to facilitate the completion of our school year this year? It's good to have you on.
Thank you, Bishop. So it's been tough. There is a 180-day mandate that class needs to be in session. Thankfully, there was a Senate Bill 75 that was passed last week that waived that requirement. So the school board, and I will talk for Stroudsburg specifically and then be a little more broad for the other districts, but everyone has pretty much moved to online class, not video classes, but online schooling. So students will be able to get their schoolwork via Google Classroom or the Sapphire portal. They can complete that work. We do have teachers that will be online to help students with any questions. It's trying. We went 2 weeks without any instruction at all, so there was some concern about how to get that going, but we just started on Monday in the Stroudsburg Area School District, and that's moving along. I will say, Bishop, that a bigger concern to me and some of my colleagues on the school board are the students that receive free lunch. We have been providing free lunch at various schools in the district, and there are some students and families that cannot get to the school to actually pick up the free lunch. So I want people to be thoughtful. Go check on your neighbors, that make sure that they're eating. Make sure that those that may not be able to get to the school to pick up the lunch, maybe you can volunteer to drive them or pick it up for them, or even pick up groceries for them. And it's strange for me to say as a school board president, but I'm more concerned about the students that aren't eating than I am about the education, because they can make that up. In terms of the teachers, I will say in Stroudsburg School District, they have been phenomenal. They have been ensuring that they've been reaching out to their students even before the online school was set up. So I, appreciate all the work that they're doing, and they've been reaching out to see how they can volunteer and support the community as well.
Bishop, we can't hear you.
I am so sorry. Can you hear me now?
Yes.
Okay.
I can say something, Bishop.
Yes.
So Pocono Mountains United Way is working with the 4 school districts, and we are exploring some creative ways. I know East Stroudsburg Area School District has adopted a model where they're using their buses to get those meals out. We're also, we've applied for now almost $200,000 in grant monies, and we hope to hear back from those grant sources soon, but it would support and complement the efforts of the 4 school districts in Monroe County, where essentially we would be creating meals at a commercial kitchen site and then delivering them to the families that may have difficulty getting to the distribution site. So we plan on working with Tameko and Stroudsburg, as well as the other 3 school districts once we get awarded those funds. So certainly we ask the community to pray for positive awards from those grant sources.
Thank you, Michael. I will be praying for that.
Yes, and we will. And I want to say, Tameko, also, what can we do in our community to be a support to you?
Well, like I said, I think it's important to for everyone to check on their neighbors. We have a lot of parents who are essential workers who may be working at a hospital, or even there's several labs in our county that require people to come in. So check on them. Maybe they need some assistance with childcare. Maybe they need food. Maybe they just need some emotional support. I know that it's tough with the social distancing, but there are some needs that we aren't considering. I read in the paper today about someone who actually attempted to kill his girlfriend, but then committed suicide because this whole social isolation just became too much for him, and he lost his job. We do have a number of people that are unemployed. We need to, show our community, as your title shows, we need to be more united as a community and just reach out to our neighbors to see how we can assist, because it's bigger than what we see on the news. It's bigger than just people getting sick. There's a whole social economic impact that still remains to be seen.
And this is so true. And we want to remember to keep you all in prayer as you lead, because there's a lot of responsibility and there's a lot of weight that comes with it. And because we do care from our heart, and it's not just a job to do, we as a community must remember to keep you all in prayer also.
Yes, thank you. We need it.
And we will continue. I'm grateful for the time that you've given. I'm glad that you're on. And we will come back again, because there's more to this than just what it is. As you stated, the mental things that take place for people mentally with all of this, it's pressure. It causes people to want to give up and make steps that they don't have to make because nobody's reached out to them, or they felt alone and isolated. So somehow within our community, as we reach across, as we call it, reach across the aisles of life and work together, we should be able to reach somebody's heart to save their soul and then keep their mind and keep them walking with their head up and not feeling like they're isolated and alone. I will allow you to have some closing remarks, each one of you, if you will. I'll start with Tameko Patterson, which I thank you again for being with us. I'm really excited that you're on here today and our community gets to hear you, and we will see you soon.
Yes, yes. Well, thank you, Bishop, and I want to thank you for all that you do in the community. Thank you for always being there and praying for us. And I know you pray for me all the time, and so I appreciate that. And I will just again, say, please just reach out. I know it's tough, but reach out to your neighbors. You don't know what they're going through. There's so many ways we can help, even just picking up the phone, picking up groceries if we're already going out. I actually did that for an elderly friend of mine. I went to the supermarket on Sunday and I called her, said, "Do you need anything?" I picked up stuff and dropped it off at her doorstep, blew my horn and drove off. So there's a lot that we can do. Support the blood bank, support the Red Cross. If you can donate blood, support the United Ways fundraiser. We can support each other. But again, just don't forget the people that live next door to you. You never know what they're going through, and they could be suffering in silence. So that's it.
Michele?
Yeah, I think that Tameko said that amazingly well, and I'm so incredibly happy and excited to be a part of this community. I've been on Michael's calls. The United Way is just an amazing organization. They are looking at so many of the needs of our community, and just so blessed to be one of the partner agencies that the United Way supports. And I just want everyone to really feel hope. That's the most important thing, is that we wake up every morning and know that it's a new day, and let's follow all of the guidance that's been given to us by the government and our local officials, and just know that we are all blessed and that everything has a purpose, and that we will stay safe and stay connected and check in with your neighbor. Think about the things that you can do to be a giver. I know for myself, I'm part of our congregational care at our church, and I was assigned just 10 phone calls this week, just 10 phone calls out of our entire congregation of 300. And, just making those 10 phone calls and not seeing my church family for as many weeks as we have already, knowing that we're coming into an Easter season. Next week is Palm Sunday, and then Easter after that. Making those phone calls and just feeling connected and knowing that people really appreciate everything that we do. And it might seem like just a phone call to you, but to them, the people that are on the receiving end, it's everything. And one of the mottos that I've tried to live my life by is, people will forget what you say, but they will never forget how you make them feel. And reaching out and making those calls, or knocking on a neighbor's door and standing 6 feet apart from them and letting them know that you're thinking of them and you're praying for them and that they are in your thoughts, is just an amazing connection. And this United States of America rises up in all of these type of situations when we have crisis. You think about how we all came together after 9/11 happened, and it's feeling a lot like that, that, good people are really doing good things, and really changing the thought process of people that might be out there. And it's a great time to really show that we are Christians by our love. So I implore all of you to think about one thing to do tomorrow after you get off this video chat, to say that you're going to do something different to make a difference in someone's life, because the smallest little things can have the hugest impact. And thank you so much for all you do, for all the support to the American Red Cross and all of our local organizations. And thank you to all of my peers that are on this call. And I appreciate the invitation so much to share my thoughts.
Michael.
Yeah, I wrote a letter to the editor last week, and I'll just highlight the one point that my grandfather once said that there's two types of people, heroes and cowards. Heroes do something and cowards do nothing. I think every person has the opportunity to be a hero by doing, as Michele and Tameko just mentioned, we can do something, whether it's at a community outreach, the phone calls, giving blood, making a donation, volunteering, sharing things on social media from credible sources, even practicing social distancing is heroic effort. So again, heroes do nothing, cowards do nothing and heroes do something. Be a hero today and tomorrow and the next day.
Well, one thing is for sure, and two is for certain. Every one of us can do something. We can touch someone's life with a word of encouragement, a deed that we do, or a smile on our face. As you've heard from each person, and each person has their own families, they're saying to you, take a little time, share your gift, volunteer to help someone else, look out for your neighbor, pick up some groceries. I'm like Tameko, I will go out and shop, get the food, put it on the steps, and keep moving. It's important that we show our love for one another. The one thing this here virus has taught us, we need one another. We need one another like never before. What can you do? What can you offer? And how can you be an extended arm to those leaders that have appeared to us today? And as you become that extended arm within the community, watch and see how strong we become. I encourage you to look for people like Bishop Williams, who is doing a food, they're giving away food on this Friday from 5 to 6 p.m. at Salt of the Earth Ministries. There's Pastor Grant on the West End. She gives away jeans and shirts to people. And there are other people doing things within the community. Let us come together and let's share what we have. I don't have all the answers. I know I don't have all the answers. And guess what? I'm glad I don't have all the answers. That's why I need my brothers and my sisters that are connected to us in faith. And one thing I can say about Monroe County and the surrounding areas, we are caring, strong, praying, and voting people. God bless everybody. Look forward to seeing you all soon.